Today, I'm Dr. Amanda Del Rosario.
And I'm Dr. Michael Lum, and we're here to answer some of your questions about coronavirus.
Why is it important to wear a mask to help contain the coronavirus?
So coronavirus, or COVID, is a type of germ that is really contagious, and it is spread by these tiny little respiratory droplets. So these droplets live in our nose and mouth, and it's where we have like our boogers and mucus and phlegm. And so if Dr. Mike were to have COVID and he were to talk or cough or sneeze on me, then those little droplets can get into my mouth or my nose or my eyes, and that's how I can get infected. The coronavirus also lives on surfaces, so things like tables, doorknobs, our phones, tablets, and our hands. So then if Dr. Mike had COVID and he were to cough on his phone or pick his nose and then decide to touch his phone, then his phone would now be contaminated with COVID. And if he were to then show me something on his phone and I were to pick it up and look at it, well, I wouldn't know that it would be contaminated because the coronavirus germs are invisible. So then if I were to touch his phone and then touch my face or pick my nose or rub my eyes, well then the coronavirus can then enter my body, and that is another way that we can get infected. So now we know that coronavirus is spread by these little respiratory droplets from our nose and mouth. And you can see how wearing a mask is a super important way of protecting ourselves. So a mask covers our nose and mouth, and it makes it harder for the coronavirus to infect us. And so we always have to make sure that our mask is not only on, but that it fits well, covers our nose and mouth, and doesn't slide down our face while we're talking or moving around. So then if Dr. Mike has coronavirus, but he's wearing his mask while he's around me, then his mask helps block those contagious respiratory droplets from reaching me. And if I wear my mask, I also protect myself from breathing in those germs. And so if we all wear our masks, we protect ourselves, and we also protect each other, and that way the coronavirus won't be able to keep spreading and making people sick.
What are some of the symptoms of coronavirus?
When people get infected with coronavirus, some people will feel fine and not have any symptoms, so they won't even know that they're sick. Others might feel like they have a bad cold or a flu. So this could mean that they have a fever, cough, sore throat, headache, maybe some body aches. You might even have some stomach pain and some diarrhea. One weird symptom that older kids and grown-ups can have is that they lose their sense of taste and smell. And in some really bad cases of coronavirus, people can have difficulty breathing and end up in the hospital.
The good news is that for most kids and young people, coronavirus doesn't really make you feel all that sick. And your body's immune system is strong enough to fight the coronavirus and recover without any problems. But for older people like our grandparents or others who have health problems like asthma or diabetes, they can get really sick and have a much harder time fighting the coronavirus. So that's why it's so important for all of us to do our part in stopping the spread of coronavirus by wearing our masks, practicing good hand hygiene, and social distancing.
Why is social distancing important?
Social distancing, or physical distancing, means keeping a safe space between yourself and other people. To practice social distancing, you should stay about 6 feet away from other people who you don't live with. 6 feet apart is about the length of 2 big dogs put together, about 2 hula hoops, a Carabao statue, the length of a door. So imagine a 6-foot circle around you, and you and the only people that are allowed in that circle are going to be the people you live with. That means when you're out of that house, you should try not to let anyone in that circle. That means no touching, hugging, or kissing. This might seem really hard to do, but remember, the coronavirus spreads when we're in close contact with other people. We know that the virus spreads when an infected person coughs, sneezes, or talks. And those droplets can get launched in the air, and we can breathe them in, and they can get into our lungs, or they can land on our nose or our mouth. But if we stay 6 feet apart, it's harder for those droplets to get us, and they'll actually fall to the ground instead, and we're less likely to get infected. Since people can actually spread the virus before they know that they are infected, it is important to stay at least 6 feet away from others, even if they seem fine and do not have any symptoms.
All right, thanks for listening and stay safe.